Welcome to Stories of Hope. I'm Christine Hotchkiss. Each week, I bring you stories that will inspire you, educate you, and give you hope. I want to thank my studio sponsor, the Motivated Mind Group, your global creative agency based right here in downtown Chandler. Today, my guests are Marcy LaRont and Paula Carvalho, and they are here representing the nonprofit organization Mission of Mercy. And their mission statement, love this, is to restore dignity, healing through love by providing free health care. Sign me up, but I'm sure there's more to it than just that. Please help me welcome my guests today, Marcy and Paula. Welcome, ladies.
Thank you, Christine. Happy to be here.
So this isn't just about a nonprofit that helps individuals with health care. As we know, health care is very expensive. And it isn't about each of you having your positions in this organization. This is personal too. And I love sharing the story of people that can relate to others that need help and didn't know that there was a resource, or other people that were in that same position. So which one of you would like to share what your personal touch is this, and then we'll get into what Mission of Mercy is all about?
Well, I'll share first.
Okay.
So I've been in the nonprofit industry for many years here in the Valley, and I've worked in healthcare and then out of healthcare in advocacy, and I returned to healthcare and direct services about 16 years ago when I had an opportunity to come to Mission of Mercy. And Mission of Mercy connects, I connect with Mission of Mercy very deeply through my own story. You know, I'm insured, I have a good job, I have everything that my family needs, and when my son was 15 years old, when he was 17 years old, he started experiencing a number of serious health issues that were hard to identify. Mm-hmm. We couldn't figure out what was going wrong. It was a new experience for us because we had always been insured, we always knew where to go, and we always found the right doctors. But this was elusive, and he had deep depression, but there were other things going on, and we weren't quite sure what that was. And so we went on a journey to find the right kind of help for him and to get to the right diagnosis. Along the journey, I was in Tucson with my daughter, and we were at a baby shower at a relative's home, and we were on our way back to Phoenix, and I got a call from the trauma nurse at St. Joseph's Hospital. And I knew it was not good, and I knew that it had to be about my son. Right. And it's the call that every parent fears, you know. And so he had been in a very serious accident. He was in the trauma center. You know, they said, you need to get here as soon as you can. He's stable right now, but we need to, you know, talk to you about what's going on. So it was a long drive. It was the longest drive from Tucson to Phoenix that day. Got to the hospital, my husband was waiting, we went in together. He looked in pretty bad shape, and the doctor pulled us aside and said, Jonathan is going to survive his injuries. He will get better, but we discovered when we did a CT scan to check for head injury that he has a brain tumor. And so this was, while that was shocking, and they said it's not life-threatening, it is life-threatening, it's not fatal, and it is operable, but it's currently building up a lot of fluid in a young boy's brain where there's a lot of space in there and creating a very serious situation. So within a month after he had recovered from a lot of his injuries, he went into brain surgery at St. Joe's Hospital.
So his accident that he was in, was it related to the trauma that you found that he had the tumor, or was this I don't like to use this as a blessing in disguise kind of thing, but it sounds as though this was a blessing in disguise because it could have happened and then there was no survival.
I mean, it was related to his depression. Okay. And so it's just a very personal and painful story still, but okay. But it was that blessing in disguise because it was the thing that was the answer. Right. You know, we finally, after a year of searching and trying to find the right doctors and the right tests, we got the answer. And then he had surgery, and then there was treatment, and then there was recovery. And while it took about a year for him to regain some of his memory loss and other things, he started to pull out. And I am just so blessed and so thrilled to share that he is, he's now 28 years old, and he has a great job. He is a manager at a little coffee shop restaurant in Phoenix, and he's doing very well. And so that was a situation where we could have easily lost him, and it looked several times like it could have gone in that direction. And we have him today, and he's whole. And it's good.
And those are the things, again, that we take for granted, that something we don't think is going to happen. I call them the unforeseen circumstances. I sit here with a lot of different people that will either have an illness that I already know about or a trauma that has happened, but there's those unforeseen circumstances. You spoke about something without being specific, which I would not want you to share because that is personal, but it brought you to where you are today, which also has you involved with this organization. And that's a good thing. And go ahead.
Sorry, it is a good thing. And what I realized through this journey is that we had all of everything at our fingertips, right? It was just managing to, get through all of the options and figure out the right treatment and get to the right doctors. Mission of Mercy patients don't have that. And so when they encounter everyday health matters, they don't have the ability to get care. If something like this happened for them, it's almost unmanageable, and it's really hard to think that, people could die, people get sicker, and they have poor quality of life, and that's the difference between the having and the not having. And so that's why we're so blessed to be able to provide that for people.
You said a lot of wonderful words and a lot of things that I think a lot of people can relate to. And before we get into the details of what that organization does, we have a special story that puts you to an attachment to this organization as well.
Well, I think, healthcare, basic healthcare is one of those things that everyone needs.
Yeah.
And you don't think about it in terms of haves and have-nots if you've been fortunate enough to be in the have category, right? And I've also lived in other countries where they had universal health care, and it looked very, very different. And I came back here, and a couple different things happened personally before I came to Mission of Mercy. And one of them was my husband was laid off, and it was the first, I wasn't working full time. First, it was a very stressful time. I ended up having a fall and broke both my ankles and injured my arm.
Oh my gosh.
And ended up with a few times back and forth to urgent care with no insurance. He wasn't working, and it was thousands and thousands and thousands of dollars. And I had never been in a situation where I hadn't had insurance before. So on the one hand, I mostly just feel incredibly blessed. It was just really, really eye-opening. We were so fortunate that we actually had some savings and could recoup, and it wasn't, with one person working, we were still okay. But I thought, my gosh, how do people live under this constant stress of this tiniest little thing happening and then losing everything, not being able to pay rent, becoming homeless, not being able to feed their kids? For some reason, that hit me really, really hard. And then I think I mentioned my grandbabies were preemies, and they were in the hospital, one of them for a month. And they had great insurance, and that was hundreds of thousands of dollars. And I now have family members that are looking at bankruptcy because I don't think they can pull out of it.
And you talked about other countries, and I do remember reading it when you gave that information to me. Hong Kong was one of them. Is that where you're referring to?
Yeah.
Because we're in the States, we're used to what we do and do not have, what we take for granted, what we think is there or isn't there. For someone like myself or anyone else that's listening and watching, what is the difference in the healthcare there that you said it was different than what we have here? So we can have a better understanding.
Ooh, that's good. So we have amazing care in the United States in terms of our physicians and the care that we are able to offer. We have people who come here from all over the world to see certain doctors and go to certain institutions, and that is absolutely true. Where we fall down tremendously is access to care. And that is where Mission of Mercy, we stand up in communities that just don't have it, and we say, wait, you do have access to care. You just didn't know it, and let us help. And not only are we going to help you and heal you, we're going to love you, because we believe all healing stems from there.
Absolutely.
But the biggest thing about universal health care, whether you're talking the UK, I guess England, not UK anymore, Hong Kong, Taiwan, is that because the system is supported publicly, and I know that is a very controversial thing, I understand, there is no pay to play. So there isn't an incentive for the organizations around medicine and hospitals and things they're not paying per everything. So there isn't an incentive there necessarily. They're not going to get a bonus for doing more tests. They're not going to get dinged if they do extra tests. And so they took their time, and they would be really cautious, and they would give you tests if they thought you needed them, just to be safe. And there was no worry that, this isn't going to get covered. If they thought you needed something, you just got it. And I found that to be pretty amazing, pretty amazing.
Do they have nonprofit organizations, just because we're going to be talking about Mission of Mercy and how it's a supplement, and I've heard a few other organizations that were founded based on stories of health care, not so much access, because we know that's a limited access, no pun intended on it as well. Are there nonprofits over there that are having to pick up like we're doing here?
Absolutely, 100%. I started my nonprofit career over there. Yeah, absolutely. It looks a little different because when you say we don't, in this country where we don't, not even maybe, the vast majority of us are not aware of how great we have it, even if it's not great by our standards that particular day or time. But their lack and where you're picking up, it has to do with much more abject poverty for the most part. And there's much more, there in places like Asia, for instance, there's still a lot of marginalization of disadvantaged but disabled populations. So there was actually a lot around, autism and any sort of mental and physical disability. So there was a lot of support. But yeah, absolutely, everybody has a need. And nonprofits everywhere, because we are absolutely essential in every community in which we reside, pick up the slack in what's needed for what to get the communities what they need.
That's such an unfortunate thing. I don't know that it'll ever be fixed, to be honest with you. I think we're just in the time zone of it and in the times of the need, especially after 2020. And I don't want to keep saying that, because we're all reminded of what that is, and we will forever be reminded of that. So coming fast forward here, you both are a part of the organization, and you talked about how it is a supplement. Tell me more about the programs, Paula.
So Mission of Mercy was founded by a pharmacist who grew up in Scottsdale, and she had really a divine calling to do work with the poor. She was married to a medical doctor, and they said, this calling, what do we do with this? Well, medical was the solution. They started here their work with a group of women and some men from a church out in Scottsdale, just coming around together and praying about, what is this going to look like? What is this Mission of Mercy going to be? And how are we going to build this up? And they launched in 1994 in the Emmitsburg, Maryland area. And this is all coming from a lot of support from people who had a strong faith and a desire to help people, to help lift people up. And because there were lots of medical folks there, it was, okay, we can provide health care for people who don't have access to care. And so in 1997, they came back to Phoenix. And this mission was born out of love. And you read our mission statement at the beginning. We are a free primary health care mobile medical clinic that serves uninsured and some underinsured people across the valley at 6 locations. And we partner with churches of different denominations as safe places for people to come, comfortable places for people to come. And they also provide us with free space, with access to volunteers and to donors, people who would like to support our work. And so we sort of come together with a lot of volunteers who have big hearts and they just want to serve. And they're retired doctors, nurses, and the like. And they just come together, they volunteer their time, they step into a clinic environment, and we just welcome people to come in who don't have the ability to get health care in other ways. They either can't afford insurance, they may not qualify, and we don't have any requirements or no eligibility process around that. If you're uninsured, we're the place for you to come when you need primary health care issues taken care of. Diabetes, hypertension, a lot of chronic conditions which can be very debilitating diseases. And if they're not properly managed and ongoingly managed with medications and visits, people are going to find themselves in advanced, disease stage and in the hospital for care that's better managed in a primary care setting.
So when you talk about it being a mobile, was it a van? What is it? A bus? What is it?
We have an amazing mobile medical RV, and anyone who's interested, we've got 6 clinics throughout Maricopa County, one of right here in Chandler, and you can come out and take a look at the mobile medical RV and see our on-site clinic partners as well, and just see what we're really all about. Paula mentioned that we don't qualify people. People will sometimes say, "Oh, you do. A lot of people do what you do," and I will say that there are other clinics out there, free or reduced clinics, but there's a qualification process, and you read our statement in the beginning, our mission statement, and it starts with restoring dignity. And we're very, very staunch about, we do not make you prove your poverty to get the care that you need. It's nobody's coming to our clinics if they have means to be somewhere else.
So now, to be more specific about the clinic part, is it someone that knows you're going to be in a certain area and they have like a cold? What are the symptoms they would come to see you?
So we are their primary care. So we have 6 clinics. We have clinic days and community partners. So we have our mobile medical unit that goes out, but we have 6 community partners in all of these cities in which we work, and we go on regular clinic days. So we try to keep a schedule, and we try to do most things by appointment. But we do become their primary care, which is probably why we see about 90% of people who have chronic conditions like diabetes and hypertension. Because if they don't get care, they're going to end up in emergency rooms, or they're going to end up deceased. There really isn't any. So we are, we're the Honor Health, the Banner Health, the, Dignity Health. We just are completely free.
Wow. So is there fundraising?
Oh, yeah.
I know, that was stupid, because I sit down with nonprofits on a regular basis. I'm also a nonprofit, and you have to have that when you don't have any other means to getting that money in there. So what kind of fundraisers do you have going on?
Well, we're really excited. So we just celebrated 25 years this year, and we had a big event last year in November, but we have our annual event this year. It will be Thursday, November 9th. It's open to the entire community. We're actually having it at the Irish Cultural Center in downtown. So you try to pick kind of fun places that are a little bit interesting.
There.
It's really neat, isn't it? It's a beautiful place, and I've been to Scotland and Ireland, and I would say, it feels very authentic.
Downtown Phoenix, if anyone wants to know, it's a really cool place to
and
experience.
You'll learn a little bit about us. It'll be a really nice and pretty short program. You'll meet some amazing people. You'll hear some amazing stories, and you'll imbibe with some great food and drink. And
so when you said to qualify, what would it be to qualify, Paula?
So when someone is uninsured, and usually they're bouncing in and out of the emergency department for really expensive care, for conditions they don't know where else to go to help manage those. And so all they have to do is call our appointment line, get to the scheduler, and schedule a time to come into our clinics. Once they're established, they're going to be returning frequently for follow-up visits, and then also for medication refills. So one of the things that we do, part of how we restore dignity, is not simply by having patients come into the clinic and examining them and giving them a diagnosis and saying, so here you go, here's a script, go to your pharmacy, get your medications, and you'll be fine. That's not how you manage patients and disease and keep people healthy. And so they return to Mission of Mercy frequently for medication refills. It's all free. They just have to come back for their regular visits, and then they get their medications on site. They learn how to use those. We have a diabetes education program, which is it's been wonderful, teaching our patients what's going on in their bodies, how can they make changes, lifestyle changes, and learn how to eat better and take better care of themselves so that they can realize a better long-term health outcomes and really be fully involved with their families, with their jobs, with their communities. And so really, it's very simple. Everything we do is very simple, and it works very well. And it's just having people call so that we know how we can help them, getting them scheduled to come in that next time.
And the primary thing too is that we don't. People will ask us like about, do you serve many homeless, and do you, you know?
I was going to ask these questions.
And we typically do, if you qualify for Access, which is Arizona's public health care system, then you're not going to come to Mission of Mercy. And the reason that is, and most homeless people, because I worked in homelessness prior to coming here, there are a lot of resources out there for them that they are eligible for. It's just a matter of connecting them to those resources. So there's a lot of people out there working to connect homeless people with resources, veterans with resources, you know, foster kids with resources. We are privately funded. We don't accept state or federal funding at all. Okay. So we have a bucket of resources, and we want to make certain that the people that see us don't have any other choices. So that's probably the biggest thing. You hear the term working poor. You know, if you make something over $15,000 as an individual person, you fall out of the Access bucket. Well, you're not going to be able to, not only can you not pay your rent.
I'm sorry, but yeah.
Yeah, you know, so, you know, but you want to work a job and continue working yourself up. So hopefully someday you won't be in that situation. You come to us for your medical care. We'll take care of you.
And when we think of clinics, we think of physicians. There's usually like a pediatrician, geriatrics. What is yours? Is it everybody? All? What is it?
Yeah, we're mostly general practice, family practice doctors. We have very few specialists on site. But we do have a great cardiologist. We've just brought on a podiatrist, a team, husband and wife team, at one of our clinic sites. And our newest volunteer doctor is going to be starting at our Mesa clinic to do eye exams for patients with diabetes, looking for those really serious conditions that cause blindness. And so it's mostly, primary care is, you know, what you're going to go to your family doctor to have taken care of. If patients have other needs, they are going to get a referral from our doctors. They're going to call around to people they know. They're going to do whatever they need to do to get them on to the next level of care. And that includes, it could include some surgeries, minor surgeries. We also have these fantastic partners in the community that we could not exist without their help. One of them is Sonora Quest Labs, who provides all of our patient labs at no cost to the patient and no cost to Mission of Mercy. That really helps our doctors to diagnose and treat conditions, and patients can go to any lab across the state, across the county, and they just hand them a slip and everything is taken care of. We have Banner and Dignity Health Hospitals who also offer services at no cost, and Centerwell Pharmacy, which is formerly Humana, who donates unused new prescription medications for our patients, and those are medications. Oh, I didn't know you could
do that.
Yes,
and prescriptions, we all know, is very expensive.
Very expensive, and we are able to supplement our annual, purchases of medications with some very expensive and hard to get medications for our patients. So those who have very complex conditions, we're able to treat those well with those kinds of contributions from our community partners.
How, and I didn't want to do this, but I'm going to, because it's healthcare, it's health. How did COVID affect you? Without getting into great detail, because we're limited on time. I know
personally
we can talk
or
about
professionally?
It. We'll do the professional part because of the organization. I know there were a lot of people that were in these categories that were not covering certain things because of that time. There wasn't any understanding of what it was. I've actually had some guests that had gone through COVID, and I just kept hearing dollar signs every time they spoke about what they had to go through. So that's why I asked how many people.
Well, I'm going to let Paula answer that question, but there's an interesting turnabout where that's concerned, completely counterintuitive. So I'll finish up with that.
Okay.
Yeah.
So what we did, being mobile was a big advantage for us. So when everything closed and the churches closed who hosted us, we were able to take our mobile unit and position it position it prominently in the parking lots of the churches we serve, so that patients who did not know if we were still open or not, if they just drove by the clinic, they would see us and they would come to the door. What we could do for them during that time was make sure that they got their medication refills, and then we could give them resources for testing. People were afraid, and our patients, they really fall into that category of having fear because they don't know the resources and they don't know what to do. And we have a lot of monolingual Spanish patients and things that, you really have to gain their trust, and they do trust us because we are always there for them. And so we did that for a period of 3 months where we had no building to set up indoor clinic space. And we continued to serve. We never closed a day during COVID. We served every single service day on our schedule during the whole time. And then we began opening up space again. But we did have to adapt and practice medicine a little bit different. Good quality medicine, just a different way of intake and getting people through the process so that they were safe. We could maintain all of those CDC requirements. And it was.
And your input, Marcy?
Well, COVID was such an interesting time because after that first, say 9 months, when everybody got wind of what was going on, and they actually really broadened services for people. So there were a lot more services for people available, certainly people in marginalized categories, than there had been previous. So that was a really great thing. So here we are now, 2023, and on April 1st they started disenroll. The COVID is over. The crisis is officially over. And so, the funding, there was lots of funding out there and things. And now they're disenrolling people. They had broadened it to pull more people into the access system to make sure people were getting care. And now they have to let all those people go. So they're starting to disenroll people. They expect to disenroll between 650 and 700,000 people this year. Wow. And at the end of 2022, we already had 800,000 people in Arizona that didn't have insurance. Wow. Which would put us well over the 1 million mark right now. So
you're busy.
Yeah, so we're necessary.
Yes,
we're really necessary, and other folks that do critical services like this. There's a lot of need out there, which is why one of the reasons we appreciate this so much, because we want people to understand they do have some choices left. We are there for them. We're in Maryvale, North Phoenix, South Phoenix, Avondale, Chandler, and Mesa.
These can be found on the website?
These can be found on the website.
Okay.
And
that's momaz.org?
Momaz.org.
Okay.
Yeah.
So I do have one final question, because we could talk a lot about healthcare and the supplements that we need for what we're doing, but I wanted to, if one of you could give me a short, maybe I love stories, right? Do you have anyone, you had already mentioned you have people that come on a regular basis because they need to and they should be able to come in and get the care that they deserve. Not so much they need, but also they deserve. Do either of you have a short success story that you could share?
Yeah, I think I would share Tony's story. Tony is super special. She's been coming to Mission of Mercy for, I think, about 10 years. Tony's father passed away when she was just 9, and she was sort of the middle child, but suddenly she became the mother figure for her younger siblings. And at 9, really hard, her mother had to go to work and also developed a gambling problem, and so was not really around for her children. And so Tony becomes this very young mother at 9, and she's getting her younger siblings up and ready for school. She's going to the grocery store with $3 or $5 a day trying to get food to feed them at night. And by the time she turned 14 or 15 and started high school, she felt like there was this wild child in her just aching to get out and be normal like other kids. And her first day of high school, somebody came up to her and said, "Let's ditch school." And she said, "Okay, that sounded like fun."
Sure.
And she never went back to school. And she fell into a life of drug abuse and prostitution, not because she sought that, but because there were a lot of things in her life that were not in place. And she spent time in and out of jail. She finally got into a program and she got her GED. Years later, fast forward, she is She found a job, she's working, but she doesn't have insurance. And she has health issues. She has extreme fatigue and pain. And so she didn't know where to go. And a coworker of hers said, you should go to Mission of Mercy. So she did, and they discovered she had high blood pressure and some other things. But Tony also had Hep C, hepatitis C, which if left untreated, hepatitis C can really lead to some very dangerous health conditions. And so Tony worked with our doctors, managed things for a while, and Dr. Smith, our great doctor, who she says he should have a red cape and an S on his back because he's so amazing, he got her qualified to receive these very expensive medications, a treatment which is 2 months that produces a cure for Hep C. And so got her involved in that program, got the medications free, and today Tony is hepatitis-free C. There's no trace in her blood of the virus, and she feels great. She is so grateful, and she continues to come to the clinic for regular checkups and her other medications, but she is a person whose life was completely turned around by her own strength and desire to become the person that she always looked to be, but didn't know how to get there.
It's a beautiful story.
And with Mission of Mercy, she now has this medical home, and she is surrounded with doctors and nurses and people who really care for her and love her. And she is so grateful, and she is just so wonderful to be around, very inspiring, and we just love her.
If I remember correctly, actually I went to your website. I think you have her posted on your store. So you have to check it out, and I never know.
She says at one point, she says, it's horrible to be in a position where you just want someone to love you or something. And that struck our doctor, just brings him to tears. But we loved on her, and she felt it, and that was a big part of everything, you know.
That's important to everybody.
Yes, it is.
It doesn't matter what walk of life. It's the one thing that we all desire is that feeling of
healing
being
through
loved.
love. Absolutely.
That's that mission statement. So yes, absolutely. So now I have this final question, and it's not related to anything that has to do with Mission of Mercy. I love the name of it, by the way. It reminds me of the song, or the band Mercy Me.
Oh, I love Mercy Me.
Me, the one that asks a bunch of questions. If I was only able to ask one question to know anything about the individual that's before me, or I think I know anything about them, it would be this question. I will let Marcy answer it first. What message would you like to leave everyone based on your journey of life?
I think, honestly, that everything we do matters. Everything, even the small things, and that if you try to move primarily from a place of love, most of the time you're going to be okay.
Same question for you.
So similar to what Marcy said, but if it's about having compassion and looking at each person as if they were your parent, your son, your daughter, you know, your friend, and being able to see through whatever that outer shell looks like, being able to see through that this is a human being that deserves love and deserves affection and understanding, and really trying to be as just and as generous as we can with our spirit, with our love, with our help, whatever that can be.
Because as you began with sharing your story, anything can happen. There's no security, whether it's losing a job or going through a trauma that did turn around. Some people don't get that turnaround. And so it's, well, are you living in the moment? Are you living for today? Yes, you have to plan for tomorrow, but are you living your best life? And are you taking it for granted, like you said, you know, no matter what, everything matters in our lives.
And are you grateful?
Oh, yes, I live by that, absolutely. Sometimes, though, people have to go through something for them to understand what that really means.
Yes.
And I think that's part of the lessons when people say, what's the point in life? I'm thinking, I could give you some answers after all the people I've sat down with, and there's so many more I haven't even heard, so bring them on. Thank you both, Marcy and Paula, for being my guests today, sharing your journeys, your stories, your information about Mission of Mercy.
Thank you, Christine.
Thank you.
Yes. Is there anything I didn't ask that you want to share real fast?
I think you were pretty good.
Yeah.
Thank you. Oh my goodness, I love what I do. I love meeting everybody and sharing stories with you, as well as it keeps me grounded and be grateful, most definitely. Giving hope is what I want to do. I want to thank my studio sponsor, the Motivated Mind Group, your global creative agency based right here in downtown Chandler. If you have a story you want to share or know someone who has a story that would help someone else along their journey in their life, please email me to the address of stories@christinehotchkiss.com. And if you'd like to be a sponsor, please email me to also the address of stories@christinehotchkiss.com. Until next time, everyone, I wish you well, and you take care.